Welcome to Some of Your Parts podcast. I'm your host, Dr. Betsy Greenleaf, premier pelvic health expert and women's wellness warrior. Join me as we discuss women's wellness topics and discuss tips and tricks with top elite health experts, and where you'll discover that you're greater than the sum of your parts. So you're not going to want to miss this double episode with celebrity skin expert Rachel Varga. Rachel Varga is a board-certified aesthetic nurse specialist since 2011, an international clinical trainer, speaker, and academically published award-winning author in the field of plastic and aesthetic nursing. Through education on skincare, skin and laser rejuvenation, non-surgical solutions, and healing lifestyle practices, Rachel helps inspire others with her unique toolkit to navigate and strategize aging well. By blending both the inner and outer aspects of the science of beauty, Rachel believes you can become your most beautiful and radiant self. I'm so excited to be welcoming my good friend, Rachel Varga. Hi, Rachel. Thank you for joining me.
Thank you so much for having me today.
So I'm really looking forward to talking to you about the things that you do and all aesthetic things. So let's start with, how did you end up in this field?
Sure. I actually get asked this all the time because I swear other people see the work that I do and they see the passion that I have and they're like, well, how do I get in on that as well, right? Especially other nurses and also physicians that I know. When I was about 25, I sought out my first rejuvenation procedure, which was an injectable procedure, as well as, really bumping up my skincare routine with medical grade skincare. And I thought that, I received okay care, but I felt like the education on the whole procedure and the products themselves, as well as the before and after care, could have been a little bit better. And I thought, I think I do a pretty good job at this. And I feel like I have a really good eye for what looks natural and how to create harmony and balance and achieve a really beautiful natural look with a lot of these non-surgical procedures, which are amazing. So when I received my treatment, I was working as a pediatric ICU nurse and undergoing my medical school prerequisites because my path was to become a physician. And after about 2 years of working as a pediatric ICU, continuing to have a few rejuvenation treatments myself, I thought, I think I really want to get into this industry. So in Vancouver, I received injectable training, which was a really comprehensive 2-day course. And to this day, what I learned in that course has still held true about 8 years later. And in 2011, I met a wonderful oculoplastic surgeon here in Victoria. I promised him a year and then I'd be off to med school. And 8 years later, 17,000 rejuvenation procedures later, I found my passion. So that's kind of the long and short of it, is how I got into the industry. I thought I just had a really good eye and really wanted to make sure that people were getting excellent education in the process of them receiving procedures.
What are the common problems that you see with people?
Sure. There are different problems related to different ages. So for example, someone in their teens, they're probably going to be complaining about acne. So, how do I reduce breakouts? Well, here's a great skincare routine and the odd treatment that you could receive. In the 20s, it's usually dealing with the acne scars in the teens and reducing the incidence of post-inflammatory hyperpigmentation, which is redness that is really annoying that occurs after a breakout. So there are some laser treatments that are helpful for that. And in the late 20s, that's typically where fine lines or wrinkles will start to occur also. And then in the 30s, a lot of times women are having their babies at that time, and they can be experiencing hormonal type pigmentation like melasma, so working with that. And then in the 40s, there's oftentimes a huge shift in the amount of collagen that women are making, again, due to hormones, so there's thinning of the skin. Also, fat, soft tissue, and bone loss starts to occur along the cheeks, the marionette zone, the jawline, as well as in the lips and even the temples. And then in the 50s to 80s, it's more or less the same across the board. It's that volume loss, Potentially people are having more sensitive skin, so they could be having more redness to their cheeks, which can sometimes be confused as rosacea, when it's really just people aren't looking after their skin properly in the way that their skin wants to be looked after. Age spots are definitely something I see, and kind of like frown lines and smile lines. It makes aging not sound fun, but what I love to do is empower women to learn how to just age really, really well and learn what works and avoid what doesn't work.
I think it's important to mention that, when we talk about beauty, it's not just this superficial, like we just all want to look beautiful. It's that if if you have confidence in the way your skin looks, then and also that's going to give you more confidence to then kind of be your own person. So you talked a little bit about that on one of the videos on your website. So
right. Yeah, my website's rachelvarga.ca, and I have a ton of resources there. I have a great treatment planning guide that if you just head over, you can download, and it's like a daytime planner for how to age really well. It's awesome. I have a number of patients saying, "Oh, I love that. Can you actually like fill it out for me and help me budget my procedures?" It's really sweet. And yeah, that education piece is really quite key. And yeah, a lot of the common things that I'm asked are, how do I take better care of my skin?
yeah, that's important.
Yeah, so for you, we did a consultation, so I kind of took you through how you personally can go about doing that.
And I think that's great that you offer that service virtually, because a lot of people don't know where to even start, especially you find yourself, maybe in a pharmacy looking at these shelves of creams and lotions, and there's some of the ones over the counter are okay, but there's even better medical grade products that are out there, and knowing what's the right product to use, it's tough. And I know you spend a lot of time with your clients, your patients on this process.
Yeah, definitely. And I can spend all the time in the world helping someone with their skincare and doing rejuvenation procedures for them, whether those are hydrofacials or chemical peels or intense pulse light lasers or erbium resurfacing or non-invasive injectable procedures. But if someone isn't doing the inner work, like you mentioned previously, it doesn't seem to matter. It's almost like I can't rejuvenate a broken heart, a sad soul, or someone who just has given up on themselves and isn't taking care of themselves. It's not like, here's $5,000, make me look better. It's not about that. It's really about encouraging women to dial in their body, mind, spirit practices, to find things that fulfill them in those different areas of their lives, because that is actually, in my experience, what my most vibrant patients are doing, which are women age 60 plus. These women are just thriving, and they're actually more beautiful than my patients in their 20s, believe it or not. You think, oh, this 20-year-old, they're going to have better skin, all this stuff, but they don't have that inner confidence, like what you mentioned at the beginning of this podcast. That takes time. So it's just incredible when I see women in their 60s and they are just owning it. They have this magnetic beauty to them, but it's really the self-care practices, and I love teaching that.
So we touched upon a couple of the different skin conditions, but I'm going to ask you a little bit about acne. Can you tell me like what is, I guess, maybe like the pathophysiology, like how this happens, what kind of skin changes you see, and what are the common things that somebody can do to help treat acne?
Definitely. Well, you do want to figure out, well, what's really causing it? And oftentimes when men and women come to see me for assistance, whether they're in their teens, their 20s, their 30s, their 40s, their 50s, it tends to lead them down a path of investigating, well, what are they putting in their bodies? What are they eating? And a lot of times when people cut out dairy, that can significantly reduce breakouts in a lot of people. And of course, things like gluten can also be triggers for things like eczema. But what it really comes down to, in my opinion, is following 4 key basics. And this isn't just for acne. This is for people that complain of their skin being sensitive and having quote unquote rosacea, which in my experience tends to be a bit of a blanket term if people have diffuse redness to their cheeks and their nose. And, hyperpigmentation, dull skin, dry skin, large pores. Cleanse the skin morning and night. Moisturize the skin morning and night, use a mineral-based sunscreen every day, and exfoliate the skin using a product that isn't going to tear the skin like a salt, sugar, or rice scrub will. And I find when people just dial in those 4 basics, they use really good medical grade products. They might get the odd hydrofacial in, especially for acne patients. It's basically a wet vac for the face. It's amazing. And it pulls out impurities using vacuum, and then it infuses different cleansing solutions into the skin, as well as a very gentle glycolic acid chemical peel. So when you incorporate really effective and comprehensive at-home care and the hydrofacial, that's a really great place to start.
So with that, what's the difference? Now I understand procedural wise it's different, but can you talk to me a little bit about the difference between like microdermabrasion versus hydrofacial and why you choose one over the other?
Sure. So microdermabrasion was pretty much it about 10 or 20 years ago, and they're not popular anymore because microdermabrasion is basically either sandblasting the skin or using this metal tip with sort of diamond grit to it that is potentially creating a vacuum to pull out impurities, and then kind of either blasting the skin with almost like a sand, or using this gritty tip, and it can actually damage the skin. And if you want a really cheap microdermabrasion, just go to your dentist because they use sandblasting as some of their tools. But that was the best back in the day. But
Sure.
microdermabrasions have evolved. And so dermal infusions. So there was the silk peel. That was great at the time as well. And now the hydrofacial is really kind of the bee's knees, in my opinion, for effective, non-invasive, simultaneous exfoliation and hydration of the skin. So you're just left with beautiful, glassy, hydrated skin.
And do patients feel anything when you do that? Is there any kind of like prep to the skin, or is it just...
That's a great question. I recommend people actually prep their skin before any skin procedure with the proper, at least those 4 skin steps that I talked about, because it's going to not only prepare their skin for a treatment so that their skin isn't going to be as reactive, because we're exposing the skin to active ingredients like glycolic acid with the hydrofacial. And if you kind of treat naive skin or skin that's never had anything done to it, sure, you're definitely going to increase your risk of sensitivity or reaction. But also why I recommend people prep their skin for about a week or 2 before the hydrofacial is because it also proves to me as a provider that they're going to follow up with their aftercare.
What kind of aftercare do they usually have to do after a hydrofacial?
Yeah, just again, those 4 key basics: cleansing, moisturizing, sun protection, and gentle exfoliation down the road. Yeah, once people cover those 4 basics, then they can start to add things like a vitamin A or a daily vitamin C cream or a facial mask, once or twice a week. Stick with the 4 basics before trying to go advanced.
Sure. And at what point do you graduate on to like having lasers and all these other procedures? There's a lot of fun machines out there that do a lot of crazy things. I guess what's in your opinion the differences between the radio frequency and the lasers and the intense pulse light, and how do you choose?
Okay, well, let me tell you. I spent a good 2 years getting my hands on some of the quote unquote best lasers out there. And I was actually really surprised with the quality of devices that are available on the market that some of these top plastic surgeons have, and they promote, they speak at conferences, and I can tell right away when someone's paid to speak on a garbage laser. And so I'm going to break it down to you. I get asked this all the time about what the different lasers are. And what I've done is actually develop a kind of an intro to aesthetics for physicians, physician assistants, nurse practitioners, registered nurses, and estheticians. And there are about 4 different types of lasers available. So you mentioned one of them, that's radio frequency. So it's basically using you understand radio frequency because I know that you have one for urogynecology, which is fantastic. But a lot of the traditional RF devices out there with needling, they try and deliver the results that, say, an erbium or CO2 is going to do a lot better job at doing, for example, for pore size refinement and collagen boosting. So you have your radio frequency, which is basically for the skin, it's almost, you could think of it like a square, and there's two metal poles on each side, and it's delivering energy between the poles. So it's basically between the distance here, it's going into a depth here. And what it's doing is it's trying to stimulate collagen and elastin in the skin. That's the aim of the game with all lasers. But some tech is going to be better than other tech. And a big trend right now is microneedling with RF. Maybe give that a couple of years, but I'm not convinced that it's the best at this time. Two of my favorite technologies are the intense pulse light. The IPL is basically a light, broadband light. Technology I love is the BBL, actually. The Cyton BBL is great. We actually just got one and I'm obsessed with it because it's so much more comfortable than the traditional IPLs in the past that you really need a numbing cream for. And they just make you like jump because it's like getting hit with an elastic band snap. And it's the brightest light you've ever seen. So the technologies are getting better and they're getting more comfortable. And those are absolutely incredible for the reds and browns in the skin. The light is actually attracted to the chromophore in blood. So the reds, it really does a good job at getting rid of diffuse redness and redness associated with rosacea and post-breakout, that redness, that hyperpigmentation, the post-inflammatory hyperpigmentation, and also browns, right? It's attracted to the chromophore in melanin, which is what gives the skin pigment. So when people have brown spots or melasma, it's really helpful for that. And some technologies are going to be better than others at, causing rebound pigmentation or not, and actually improving the problem. And then erbium lasers are awesome for resurfacing. So erbium, the chromophore associated with that is actually water. So what it does is it vaporizes the top layer of the skin off. So you get the smoke in the air. So you have to have really good vacuum, in the room so that you as a provider aren't inhaling it. And also you as a potential patient aren't inhaling your own personal barbecue. But it's great because when that skin is vaporized and that process occurs, the dead skin actually doesn't stay on the skin, which can cause kind of like it can require a long time to heal. So 10 days versus 3 days. So just because something's an IPL or something's an erbium doesn't mean that they're all the same, because the way the energy is delivered can be totally different from one tech to the other. And then, of course, the gold standard for deep resurfacing is going to be the CO2. So oftentimes that's accompanied with like a facelift or an eyelid surgery to basically turn the clock back about 10 to 20 years. But that requires about a month of downtime, so people can't often accommodate that in their routine. And then there's all these other flaky type of devices that feel like a hot stone massage. I mean, really, like, what is that actually going to do for the skin? So it's important, if you or you listening are considering having laser treatments, just look at the clinical studies that are associated with the different technologies, because some of them are actually causing a shift in gene expression. And I can give you the link for this one, but one laser in particular, the BBL, what it can do is there's been a study where it's checked out the genes that are turned on and off in someone in their 50s. And then after a laser treatment, their genes are actually being expressed in a way that's more similar to that in someone in their 30s.
Wow. That's
so there
amazing.
can actually
Research on that.
I know, right? And I can send you the link for that study, but it's really cool how with some of this new tech, we can actually change our skin's gene expression.
Which is really goes into rejuvenation. We're actually, turning back time on our skin. So that's amazing.
Mm-hmm. Yeah, that's when I heard that study, I was like, whoa, that's pretty cool.
I think it's important though for people to realize that these treatments aren't like a one-time deal. Like, all right, you get your face lasered, and now you're going to be 18 for the rest of your life. So that these things, you still age, and so your skin will get better, but it will eventually start catching up with you again. And so this is something that, if you want to keep it at that level, from periodically you have to keep doing it.
Yeah.
So
And we lose
how
about,
often do you see that people have to do, say, like, I know erbium is your favorite. How often does that have to be done?
well, I'd say a combination of IPL and erbium. So
Okay.
focusing on IPL in the fall and winter, maybe getting about 1 to 3 of those done when you don't have a tan, and about a month apart is pretty key. And then getting maybe 1 to 3 resurfacing erbium treatments under your belt when you can accommodate about 3 to 4 days of redness, which can end up being once or twice a year. But we lose about 1 to 3% of our collagen every year. So a good rule of thumb is to have at least 1 to 3 laser treatments a year to mitigate that collagen and elastin loss.
I'm so fascinated by the idea that they found that these different wavelengths of light will trigger regeneration of our tissue. I would love to someday try to figure out who found that out and how they figured that out, because it's really amazing.
One of my patients today actually asked me that question, and I haven't really ever heard of it being explained this way, but lasers were actually initially looked at as weapons.
Sure.
So think about the time, about, what is that, 70 years ago, where things were looking at being weaponized and being tested on people. So I actually think a lot of this laser technology was really identified and tested during World War II. And so looking at the interactions on the skin, I know this is a crazy topic to bring up, but honestly, that's kind of where the history I think is pointing to.
Sure.
Do you know what I'm getting at there? I mean,
Yeah.
it's kind of sad. And then now, thankfully, the tests with lasers and whatnot are typically done on pig skin, which obviously isn't great either. But yeah, lasers have come a long way as either, being used as a potential weapon or to rejuvenate.
It's amazing though how you start off with one discovery and then it leads into another. I think I told you before that there's a skin cream that I use, but it was originally discovered because they were trying to create a medication for diabetes, and when they were testing it on rats, instead of it helping with the diabetes, their skin was getting tighter because it actually was ridding the body of these glucose byproducts that was damaging the elastin. So it's funny how they discover things.
Yeah, so glycation, that's something that I see in patients with diabetes, is their skin looks really kind of rough, and it's the glycation end products, which I think is what you might be alluding to.
Yes.
And there are products out there that actually reduce glycation in the skin.
And another reason why to eat healthy, because if you're eating all those sugars, you might not be diabetic, but if you're eating a lot of sugar, that's going to affect your skin.
Yeah, and of course, smoking. I mean, people who are listening to this and are smokers probably, oh, great, not another person telling me not to smoke. But honestly, when I've seen patients quit smoking, in as little as 2 weeks, they lose that dusky hue, that gray pallor, and
Sure.
they look healthier and more vibrant. In just a couple of weeks, the body has this beautiful innate ability to want to heal itself.
Do you have any kind of favorite cleansers that you use? Or is it, I know, I'm sure it depends on the patient's skin condition, but in general, do you have anything that you'd like?
Yeah, absolutely. It 100% depends on what the patient needs. So, for example, me, I'm in my 30s and I'm still acne prone. I need something with a little salicylic acid. So, one of my favorite cleansers now is the Alumier Acne Balancing Wash. And someone like yourself, you could do better with more like a glycolic acid based and not salicylic, because the salicylic might be a bit too drying on your skin. But typically people respond well to a little bit of glycolic acid in their cleansers to get off the dirt, oil, debris, and pollution, which can get trapped in the skin and actually cause rosacea-like symptoms of diffuse redness because you get all this garbage being left on the skin. I should put a nickel in a jar every time someone comes to me and they say, why is my skin sensitive? I wash my face with water. Well, first of all, water is not pH balanced to the skin. The skin's actually more acidic than water. And you need to get off the dirt, oil, debris, and pollution of the day, because if you're not, you're just moving it around and then you put your moisturizer on, you're just compounding toxins on your skin. So cleansing morning and night, not just a splash of water, not using your body wash, but go medical grade and something with a formulation that's right for your skin.
It's interesting too, because I remember growing up, for me, it was, and how things changed. It was like, oh, don't scrub your face. Don't scrub your face. Scrubbing your face is really bad. And now you see all these devices that look like these power brushes that people are using on their face. What is it with scrubbing your face versus not scrubbing your face?
Yeah. So gimmicks are a dime a dozen these days, which is why I'm so passionate about helping people understand what really works and avoid the garbage and avoid the gimmicks. So there are different devices out there, like the Clarisonic handheld device that claims to give your skin a really good wash, or these microfiber cloths, right, that are claiming to be antimicrobial. Honestly, I prefer to use a cleanser solution, massage it into my skin, do a double cleanse at nighttime in the shower before bed to get a really good clean, and then just kind of like pat the skin a little bit. You don't need to spend a lot of money on these devices or scrubbing things or microfiber cloths. Just get a really good pH balanced cleanser, in my opinion.
And then now I'm going to ask you about some Botox.
Mm-hmm.
So Botox is really the brand name, but there's a lot of different botulinum toxins that are on the market.
Yep.
And for people who don't know, I'm going to have you just explain a little bit about what does botulinum toxin do and why is it used cosmetically?
Sure. Well, I just wrote an academic article on this very topic and won an award for it, an internationally published academic article on the topic of rejuvenating the eyes. And that was the first place actually botulinum toxin was used in the 80s to treat things like blepharospasm and other disorders of the muscles around the eyes right here in Vancouver, which is just, I live on Vancouver Island. So I'm kind of right in the heart of where it was discovered. And believe it or not, the west coast of Canada, this is something I heard about 10 years ago. So I'm not 100% sure if this is true, but what I heard in the past was that we are the number one users of Botox per capita in the world because we're living really healthy lives and we want to look good in the process. However, there are different types of botulinum toxins available. So basically, botulinum toxin is a naturally occurring bacteria. So say, for example, if you eat bad meat and it's contaminated with botulinum, what happens is you eat that meat and it makes you sick. In the stomach, the body puts proteins, complexing proteins around the botulinum to protect it. So Botox was actually made to kind of mimic that, if you will, and then put in a bottle, freeze dried, and then you add normal saline and you inject it. So what's really interesting now is that those complexing proteins in Botox and Dysport and a number of other different neuromodulators, they actually don't need to be there. So if you think about the actual active component in, for example, Botox or a neuromodulator, it weighs about 175 kilodaltons. So that's the active component. And what that does when it's injected in certain facial muscles is it reduces the message from the nerve to the muscle. It takes about 2 weeks to work and lasts about 3 to 6 months. I'd say 3 to 4 on average. What we're finding now is those proteins that, remember I mentioned that the stomach, when you eat botulinum, the stomach, your body naturally puts the proteins around it. What we're finding now is that the proteins can actually cause higher rates of this to not work in people over time.
Oh, wow.
So we're seeing rates of non-responders, which is really important, really interesting. So there are products available that actually don't have any of the complexing proteins. and it's just the active component. So if you're looking at going for cleaner skincare and cleaner injectable options, Xeomin is actually the one at this point that pretty much just weighs 175 kilodaltons, which is just the active component, versus Botox, which weighs about 900 kilodaltons. And so that difference in weight is related to proteins. And in the past, Botox weighed well over 1,000 kilodaltons. So they've been kind of tweaking the formulation a little bit. But as with anything, always check with your physician or your provider to see which option is right for you. But that's kind of a bit of a history of the different types of products that are available. And new science is always coming out. So I don't know about you, but I always want to stick with what's cleaner.
Sure. And it's interesting to see now, because I remember when Botox came out cosmetically years ago as being used to kind of smooth out, and I say smooth out wrinkles. I think a lot of people, when I explain to them how it works, is that, it's basically just relaxing that muscle so you're not making those wrinkles. That it's not necessarily filling in or smoothing like the other products are used for that. But it's interesting because it was used more as a treatment, and now I'm seeing more people doing it as a preventative.
100%.
So yeah, when are people starting this, and what are you seeing in that field?
I started when I was 25. It's like, what are those wrinkles doing on my face?
Yeah.
And of course, coupling that with good skincare, sun protection. So my generation is all about what can we do to live healthier, to have a better quality of life when we're older. And it's funny, something as simple as receiving a rejuvenation procedure, that aspect of self-care in a certain type of personality or individual is often indicative of the way that they're looking after themselves in other areas of their life. And vice versa, if someone's going to yoga every day or they're following a really good diet, when people look after themselves in regards to their body, mind, and spirit, they're going to live better. And that's something that my generation is really tuning into. And so my patients, when they meet with me for the first time in their 50s, 60s, 70s, 80s, bless their hearts, they're saying to me, I really wish I didn't tan with all that iodine and baby oil.
Sure. Oh, yeah.
Yeah. So it's that shift in thinking. It's that prevention. It's really effective at preventing wrinkles, but it's almost like you don't want to get hooked on it and you don't want to develop body dysmorphia. So it's about finding a provider, if you are going to start these treatments in your 20s, 30s, or 40s, to find someone that will help you look natural in the process. And my favorite tip to share with people is always take a look at your injector. If they look crazy, you'll look crazy. And also the staff and the people coming in and out of the office. It's a really good indicator of the type of work that you'll receive.
That is funny. Yeah. What is it about Botox where some people get that look where they're just look surprised all the time? Obviously, you don't see that as much, but I remember when Botox came out initially, I don't know, if it was where people were getting injected or how much, but they always had this looked like deer in headlights. Looked like they were super surprised.
Or the spocked eyebrows, right? Where it's
yeah. Yeah.
All right. So I'll break this down for you. The outcome of the treatment really depends on who's providing the treatment. So just because a provider is using a neuromodulator like Botox, Xeomin, Dysport, Jeuveau, Nuceiva, these are all brands. There's been 2 new neuromodulators in the North American market this year. There's always new ones coming out because people always, for some reason, want to have the newest, latest, greatest, whatever is marketed. And I have a 7-8-year rule. Actually, I like to only recommend things to people that has been studied long-term on the general public. So you will never see me diving into the latest and greatest. Where's the clinical data? How do we know this is safe? What's the long-term data? I want to know. And so with these injectable procedures, where the product is placed, so for example, between the brows here is the number one non-surgical cosmetic treatment in the world, is neuromodulator in this area to soften the frown lines, right? So it's placed in these areas here and then around the eyes also. And if you read my paper, I actually share my particular injection sites to give a really beautiful lift. However, when a provider lifts too much, right? And the brow position is then in a position that's really unnatural looking. They got to take a page out of Leonardo da Vinci's playbook here, because the ideal facial ratios are really what we want to guide these types of rejuvenation procedures. So, for example, when you see someone and their lips enter the Starbucks line before they do, or they have that really surprised look, it's because their provider just doesn't understand the concept of the ideal facial ratios. So I did a training this year in Vancouver at a clinic, and afterwards I had feedback from the clinic saying, oh, your techniques, my brows weren't as high as they usually were. And they usually are, and I don't like that. Well, you look at the before photo of the person and they were used to that look.
Oh, wow.
Right?
Yeah.
Mm-hmm. So based on different techniques, you're going to achieve either a more natural looking outcome by having the brow placed where it should be placed, or it's arched up so your eyebrows are at your forehead and it just doesn't look right, and then you're surprised all the time. Or the worst is if you get a drop from improper technique, or that Spock. And I see it all the time. And that's usually when people look for another provider.
Yeah. Well, the nice thing about Botox is that it wears off eventually. So if you do get an over treatment, you just got to wait, and eventually it'll get better.
Yeah, so that's kind of one of the nice things about it, but it's also kind of one of the bad things about it. So people are like, oh, I'd really love to have this last like a year or two. But the thing is if you get a botched treatment and you get a brow drop or an eyelid droop, you're going to be stuck with that for a long time. So I kind of like that it's temporary, so that if there is an issue, it can be mitigated. But yeah, there's all sorts of other areas that it can be used to, between the brows, the eyes, to lift the eyes, give a non-surgical eyelid lift, reduce puffiness to the lower eyelid, give a lip flip, reduce the gummy smile, shrink the jowls, and give a little bit of a tuck to the under the chin. And there's a lot of quote unquote off-label treatments that are performed worldwide, and it can be actually quite common practice to do off-label treatments. Say, for example, taking Tylenol. An off-label use of Tylenol is a fever, right? Treating a fever. There's all sorts of off-label uses. So it's just important that your provider tells you what's either on-label or off-label for that product. But now you're going to ask me about duck lips, aren't you?
How did you know?
Because everybody asks me all the same stuff. You were actually going to ask me about duck lips next, weren't you?
I was, because it is. You see that. I mean, you see when these women get their lips done, and you're right, and they enter their lips enter the room before they do, and I go, what did they get done? So
yeah, if you think it bothers you, imagine how much it bothers me. Because I want to like slap the provider that did that to them.
Yeah.
And this can also be a rookie move. So say, for example, someone walks into a med spa or plastic surgery, cosmetic dermatology clinic. They all go by various names based on their specialties and things like that. And women over 50 are going to say, I really want to soften the lines around my mouth, right? It's like the first thing that people are going to ask for is softening lip lines, because women get those barcode lines even if they're not smokers. By the way, if you're a side sleeper, I want you to tonight sleep like you're a pharaoh, because when you side sleep, you're squishing your face.
I know, I found out it was my problem after you did my analysis.
I know, I taught you that, right? It's like every vertical line on the face is a sleep line. So sleep like a pharaoh. You'll think of me every night before you go to bed. It'll be great. Yeah. And anyways, all jokes aside, when a person goes to a provider and wants to soften those lip lines, a rookie provider is going to say, sure, let's just focus that. But an advanced provider or an expert provider, and these are the type of approaches that I teach internationally, whether I'm speaking or actually doing clinical trainings, is to revolumize the jawline and the cheeks at the same time. So when you see a young woman and their lips are like, right, and their chin has been recessed back, but it hasn't been dealt with because we lose bone in our mandible. When you reform the lips, but you forget about the jawline, what happens is you get this type of thing happen. So what you ideally want when you're getting injectable procedures like hyaluronic acid dermal fillers that have been used for decades, they're fine in the right hands. You want to revolumize the lips, revolumize the marionette and jawline and the cheeks together so that everything is proportionally enhanced, as opposed to just doing one area and then right away your face is going to be out of your own ideal facial ratio, proportion, all that.
Yeah, that's the one thing is that I've been trained on doing fillers, but for me, they scare me a little bit. And I think it's because of lack of experience. But, I've heard these stories that, with fillers, if you accidentally inject it into a vessel, a blood vessel, you could kill off all the tissue overlying that area. So
Yep.
how do people safely get fillers, and what are appropriate uses of fillers? And
Sure. Well, as with everything, there's always a risk of side effect. So I'm always shocked when someone comes to me and they've had fillers before and I say, yeah, this could make you blind, or this could lead another area of the face to not get the blood supply it needs. But this is what to look for. So if it happens, you can reach out to me quickly and we can dissolve it with hyaluronidase, which is an enzyme that breaks down hyaluronic acid, which is what's composed of the dermal filler and which is naturally occurring in our skin. This is kind of like an antidote, but that being said, yeah, you got to have a respect for the facial anatomy, and your treatments will become safer when you understand the facial vasculature or the blood vessels of the face. So obviously, having a really good understanding of this, which is also something that I teach, is really important to reduce the incidences of side effects. But the highest risk areas are actually the nasolabial folds, the nasal bridge, and the glabella. So when you're having your cheeks done, a little bit around the lips and the marionette zone, you are not in those really high risk areas, but there have been risks of what's called vascular occlusion or blindness actually associated from those areas. And one of my colleagues, she goes by Jupiter Julie on Instagram, adore her. I had a chance of meeting her in San Diego this summer, right after we met in Mindshare in San Diego. It was like 3 weeks before that. She was actually just on the doctor show, and she was speaking out against this YouTuber. This is a really hot topic right now, by the way, especially in the US. She was speaking out about this YouTuber who had bought her own dermal filler online.
Oh my God.
And self-injects herself. And she films herself doing the plasma pen, doing at-home microneedling, doing her own Botox, doing her own hyaluronic acid filler. So pretty much all of us injectors out there are not showing any videos of us doing any procedures anymore. And in fact, earlier you're like, oh, I went on your website and I couldn't find this video. Yeah, it's because I took it down. That stuff is going to be it's going to be private paid content. So if people want to learn from our techniques, there's avenues to actually get that education, because we really need to promote public safety. And, we're sharing our techniques to kind of elevate the nursing practice of cosmetic dermatology, or physicians wanting to share their approaches with colleagues to uplift their professional area of expertise. But people are trying to do it on their own. Who would have thought, right?
Well, there was a case, and I don't know exactly where it was, but it was someplace in the United States. I remember this was a few years back. There was a woman who was not a nurse, not a doctor, who was doing injections, and she was using, like, I want to say bathroom caulk, like some kind of silicone that you'd buy from Home Depot, one of these, home supply stores, and was injecting it, like back room injecting people, and people are paying this woman money. And then of course, having this product injected into their skin that shouldn't have been injected, and having all these, these health problems. They
you could kill someone.
Her, but I think it was, crazy.
Yeah. This is something that we are hearing a little bit more about. I sound so very Canadian when I say that. All jokes aside, if you go online and you try and buy filler or Botox online, you can get them from different places in China, and they're counterfeit products. You can only get these products directly from the manufacturers and not a distributor, and you typically need a medical license, or in Canada and the US and certain provinces or states as a nurse practitioner or a nurse. It really depends on the legislation in the area. But when people try and open up shop and they're not health regulated providers, they're getting their products from these counterfeit websites, and who knows what's in it. It's funny. I did a YouTube video on this on my Rachel Varga YouTube channel, and I kind of went on one of these websites myself and then looked through the reviews, and people were saying, "Oh yeah, I bought this product. The box looked like it was real." I'm like, well, that Louis Vuitton on eBay also looks like it's real, but you don't know until you actually do testing on the product actually inside the vial. And there was a clinic in Vancouver a number of years ago that was shut down because it was a fake doctor. Even in Canada, I mean, you hear more about this stuff in like the US, but even in Canada, even though we're ultra conservative here for the most part, more conservative. And yeah, some of the fillers were actually investigated, and it was like silicone caulking. Yeah. So who knows, right? So that's why a lot of us healthcare providers in the field of aesthetics and rejuvenation are really speaking out about this, because what happens is people try and save money, right? I'm guilty of it. When I was 24, I got laser hair removal off Groupon. And when you're, trying to save some money, you don't necessarily know. And so good rule of thumb, if you're wanting to get things like laser or hair removal or injectables, check with your local health authority to see if they are actually qualified to be providing those types of treatments in your area. That's really the only way to know, just because the legislation is different in absolutely every province or state. But people try and save money, and unfortunately they just don't know, and they can really be taken advantage of. So that's one of the reasons why I feel so passionate about educating people on which products and procedures are actually backed by science. There's papers to prove that they're clinically effective, and they're not going to harm people, because things can be Health Canada approved or FDA approved, like those hyaluron pens, which is basically high pressure hyaluronic acid shot into the skin without needles, and it can still cause vascular occlusions. So even though something is new and it's approved, it doesn't necessarily mean it's safe. So 8-year rule.
Yeah, no, I agree. And it's kind of like you get what you pay for. Like, you don't want to get that bargain facelift. You kind of want to
people don't know.
Yeah. The other thing is I don't know if you've seen this with facial products, and not just injectables, but with cleansers and moisturizers, that a lot of the companies that I've dealt with won't sell on Amazon. Mm-hmm. And so, but all of a sudden you see those products on Amazon, and you don't know, number one, are they counterfeit? Or number two, are they like somebody's products that have been sitting in like a really hot room and that hasn't been stored properly, and now they're trying to get rid of them.
And the active ingredients have become unstable, like vitamin C or E. And when actives like that are unstable, they can actually become free radicals and damage the skin. Okay, I'm going to share with you a story here. Sure. So when I was kind of learning about internet marketing a little bit, I was watching this video of a gentleman. He was doing a lecture at Facebook, and he was saying, "Oh, I have this buddy, and he crushed it with these internet marketing ads. He made tens of millions of dollars, and all he was doing was going to Costco, buying Lubriderm or Neutrogena or whatever brand, and putting them in his own bottles and charging like $200 a bottle." So yeah, I know, right? So when you are buying products not from professional providers, who knows what they are? So again, I work with skincare products, both in the clinic and online, that are backed by research, and they have clinicals to back up their claims.
Yeah, that's really important. You got to have to protect yourselves and know where you're getting it, and find a reliable source or a reliable practitioner. And
yeah, microneedling is a big one too. So people trying to buy these rollers online, and you can get 5-pack of microneedling at-home rollers for like $20. They're from China. They're made of different types of metals. So it's an alloy, But up close on these rollers, they're not actually little needles, they're actually blades. And one of my colleagues in town here, she actually used to work with Dr. Lance Setterfield, who wrote the book. He's the godfather of microneedling. And she's telling me a story once about how a needle actually came off one of these garbage rollers and got stuck in someone's skin.
Oh gosh. Yeah.
So a good roller is actually going to be about 150 bucks Canadian, not $10 for a 5-pack.
Yeah. Yeah. And I've
and
actually
not made of an alloy.
I've looked at those and I'm like, I don't know.
Rachel would know.
Yeah. Yeah.
Yeah. Typically you're going to want something that's made of like a surgical steel, right? That's what most medical equipment is made of. Sometimes it's titanium, but it's not going to be an alloy, and it's definitely not going to come from China. But there are websites that say, oh, this roller is CE accredited or FDA approved. And it's actually not. It's not that big of a process, so I've heard, to actually have a device be approved by these regulatory bodies that can kind of look legit on a box. I'm not speaking directly to FDA. There's like other acronyms that you'll find on a box that might make it look legit, but doesn't mean it is. And even some professional providers, they think they're buying really good microneedling devices, but they're still from China and they're still garbage. And they're just trying to do the best they can too. So it's really tricky, actually.
And I think the scary thing with the microneedling is that you don't even know if these products are sterile. And here you are basically making small punctures into your skin, which I would want to have a good medical device for, not something that I got off of, eBay or Amazon that I don't know, how it's been processed, if it's sterile, what it's made out of. So
you got it. What was the manufacturing facility like?
Yeah. Oh, sure.
Yeah. I work with 2 rollers, one that's made in South Africa and one that's made in California.
And then 2, I mean, when those are used, they're used, or when you use it on someone, it's used once and then, right?
I don't do in-office needling. Honestly, I think that people are going to get a better bang for their buck if they buy the roller and have, say, the right copper peptide and vitamin serum to use at home that's been studied to be safe and effective with the roller, because when you're causing the micro channels in the skin, it's allowing the product to actually penetrate about 1,000 times deeper. So you need to be using products that are going to be safe to be used on the skin at that depth.
Okay, great. And one of the things I want people to know about with you is your website and the services that you provide with your virtual consults. So
Thanks, Betsy.
If you could talk about that.
Sure. So one of the reasons why I'm actually on the online space, you're probably thinking, well, what is a registered nurse doing online talking about beauty and anti-aging? Well, I'll tell you, when patients come to me, sometimes they'll say, oh, I had a consultation at this other clinic and it was 15 minutes and I met with a consultant and I just got sold laser injectable and skincare packages. And then I had my hour-long consultation with you and you gave me a really thorough assessment of my personal facial aging, which products could be helpful for my specific needs. And you really broke down and helped me understand how I can really benefit from laser treatments and how they're going to get rid of my redness or brown spots. And unfortunately, women are very vulnerable as they age, and I don't take that lightly. So it occurred to me, it's like, well, I don't think it's very fair for just people in my local community here to get this information. I should be making this information available online to whoever wants it, right? So that's why I developed the online anti-aging consultation. It's an hour-long consult that you can book with me at rachelvarga.ca. And if you go there, you'll be able to download my free treatment planning guide. But then beyond the consultation is all that body, mind, spirit stuff. That first thing you asked me, the first question, second question you asked me, what else can women do to age well? Well, there's a ton of things, and I won't have the ability to tell you in an hour. So I have my Unlocking Your Vitality ebook that's available also to purchase at rachelvarga.ca, and the companion course, which I actually filmed on a beautiful island called Salt Spring Island. It's like this hippie island on the west coast of Canada. And that's where I go to really recharge my batteries and feel good. But I really hold your hand and walk you through the different ways to age well based on what my most vibrant patients have taught me.
Those are great. Thank you for doing all that stuff. I think it's absolutely wonderful.
Yeah, thanks. And I thought for sure that the impact that I would be making for people would be, the patients themselves, and educating the patients so that no matter where they are, they'll be too smart to get suckered into that $500 skincare cream or that $2,000 laser. And they'll really understand what could be helpful for them and and become very discerning. But where it's actually become a little bit more expansive than I imagined was actually with the international teaching. I love teaching other providers so that they can provide the level of care that, I just think is appropriate. So it's creating a bit of a ripple in the industry, and it's been very well received by my peers. Thank goodness.
That's great. And you've been presenting papers all over the place every time I look too.
Yeah, I'm working on another one actually. So the paper I just finished that I won an award on was for rejuvenation to the upper face, and my next one is for the mid and lower face. So it's just to help my peers to do treatments in a safer way and get really great natural looking results. And I love teaching. It's become my new passion.
That is wonderful. Well, thank you very much, Rachel, for all your tips. And I'm looking forward to hearing more from you. And I'm going to be directing our listeners to your page. And
thanks. And one of your backgrounds is in urogynecology and also in the area of CBD. And I just want to share with our listeners that also on my podcast, the Rachel Varga podcast, we have a great conversation on there also. And we talk a little bit about some of the gimmicks with CBD skincare and all that stuff. So yeah, it's been great collaborating with you and getting good health information out there. What are you most passionate about sharing with your audience?
My biggest message is that we're not just our different body parts, and that our body, our mind, our spirit, just like you said before, all have to work together. Mm-hmm. So that's why I kind of came up with I stole from the math concept, but I turned it into my tagline, is that you're greater than the sum of your parts. So,
and then we're also greater when we all work together and collaborate and help each other out.
Yeah, I agree. I agree.
Awesome. Well, thank you so much for having me. And I hope that your listeners got a good laugh out of this episode. You don't have to get down on yourself for aging. Aging doesn't have to be a bad thing. It can be a really cool journey, but there's just ways to be a little bit smarter about that journey.
Today's episode was brought to you by the Pelvic Floor Store, your source for personal health. You can find us at www.pelvicfloorstore.com. For more information on today's episode and women's wellness, please go to drbetsygreenleaf.com.